My name is Dr. Nicole Shields. I am a family medicine physician. I practice in Claiborne County, which is in Tazewell, Tennessee. I've been there since 2013, seeing patients in rural primary care. I am a family medicine physician, trained in rural primary care, and I see everyone, which is the beautiful thing about family medicine. In a day, I will see a newborn and then sometimes transition someone to hospice at the end of their life. So, see all of it. I originally am from Florida. My husband's family retired in East Tennessee because it's beautiful. And when we decided to start a family and he separated from the military, we wanted to be close to family, and we visited East Tennessee and never left. And I love it. I am from a small town. And so I understood the importance of having healthcare providers in rural areas. In addition to falling in love with family medicine, at the time I didn't realize that family medicine and rural medicine go hand in hand. But as I completed my training and did residency training program, it kind of opened my eyes to like, oh my goodness, I can do all these things. There are so many things, and it really depends on the day, and that's the beauty of primary care and family medicine in particular, is that every day is different. So it's almost like opening up a present every day. You're like, well, I know what patients I'm going to see, but what's going to be their story? It's a challenge, big challenge sometimes, but I love being able to walk into a room and just sitting down and having that experience and that connection with people and being part of their healthcare team. I try to build partnerships with most of my patients, and so it's like seeing an old friend. Family medicine allows you to really have a pulse on what's needed, where the holes are, where there's gaps in care, where there's an opportunity for the system to help patients. I think that Covenant provides a network of quality physicians that are practicing evidence-based medicine responsibly and ethically. And I really appreciate having that network and relationships with other physicians and specialties to refer to, because I know they're getting the same care that I would want my own family to have. So being part of that system, I really value. East Tennessee is so beautiful. With the mountains in the backdrop of the Smoky Mountains, misty mornings in all four seasons. It's just like nowhere I've ever experienced before. And I think there's something for everyone here, whether you want to participate in farm life or if you are a lake person and like water sports or fishing. And Knoxville is growing so fast that there's so many opportunities for people who are more interested in things that cities can provide. But I think that being part of this community for as long as I've been here, I've been welcomed with open arms. And once you're part of the community, it's really hard to leave. We have a farm. I live on a lakeside farm where we practice regenerative farming. And so when we talk about taking care of a community and patients, we live that literally every day at our house. From raising chickens and gardening to being responsible with organic farming and cattle. It's an interesting opportunity to take care of our little corner of the world, and we really enjoy participating in that rural community responsibly and in a way that hopefully will have something to hand over to the generations to come. my best advice for students who are thinking about a specialty is family medicine is one of the most wonderful experiences in medicine because you get to experience the whole story. If you're the kind of person who likes the whole book, not just the beginning or the end, but the whole story, family medicine might be the right pick for you because you get to be part of someone's life, sometimes from beginning to end, and get to be sometimes a very integral part, intimate part of people's stories and their lives. I think that Covenant healthcare system is committed to primary care. They are committed to excellence in everything we do, particularly in primary care. And I think that in this area, you have so many opportunities as a family medicine physician and resident to experience everything from rural medicine to urgent care to primary care to more concierge medicine. I just think that there's so many doors that will remain open to residents that train here with us. It's wonderful to not limit yourself right at the beginning of your career and to be able to experience those different things because they're all very different and you never know, where you might end up and what you might end up loving.